Hi, this is Hannah Nyron with EdTech Times, and today I am speaking with
MJ Ryan. I'm the Workforce Development Director for Partners Healthcare System.
So tell me about what you're doing here at the LearnLaunch conference today.
I was invited to present on a panel that would talk about EdTech in the enterprise. And we've been working with technology as enabler for career advancement and academic advancement for our employees across the healthcare system since probably 2007, 2008.
Wow. So what conversations were had during this panel? What were the main points discussed?
I think the main points from our perspective was the increasing access to education, to higher education, and to opportunity for all. And in that light, we were able to hear from one of my colleagues that was on the panel who was with Penn Foster, and how they've engaged with employees and employers and how they've worked to create programs that align with the needs of the employer. And he's done a lot of really good work in that space, as well as investors who understand the importance of this work and invest in this kind of education.
So I think a lot of people might see Partners Healthcare and EdTech as two very separate things. So what is the connection between Partners Healthcare and EdTech?
So Partners Healthcare is a dedicated to teaching and exploring new things and innovating. So it actually all comes together very, very well. In the space that I work in workforce development, we want to ensure that all of our employees have access to the opportunities with higher education, as do our higher level physicians and researchers. So we want to make sure that we have equity in education, and the only way to provide that access we're finding is through technology. We work 3 shifts, 24/7, and the way to work with employees that don't have the luxury of leaving work and sitting in a classroom, we found that technology helps us to bridge that gap for them and give everyone an equal access.
And so what is your role in working with these technologies?
So my role is to work with anyone who I think can help us. We have worked with several tech firms. We work with Oho Interactive out of Cambridge, who have helped us to create a program called the Online College Prep Program. And we first worked on a basic Ning platform for free with another online learning expert, Ryan Bush. So we look to find any way we can help bring access to our employees. We've worked with College for America. So I guess our connection is anything they can do for us to help us better serve our employees and those that we want to help advance works.
That's great. And how long have you been using technology to help train your employees?
We started, going way back, we've done some mandatory in-service training on programs like HealthStream and other kind of store-bought programs that we could enhance, and that's just general training. But as far as creating access to education, we started with a grant from the Boston Foundation back in 2007 called the Allied Health Initiative, and our goal was to test technology as enabler. We tried and failed for about 3 years straight. We tried various off-the-shelf software programs that just didn't work for many of our employees, and we had a hard time, even with very intensive coaching on our part. We worked with Bunker Hill Community College to create some online higher level advanced modality imaging programs with them, and even those individuals who had a lot of access to computers every day and worked with them every day had trouble learning online. So we went down that path of the online learning preparation. And we have a program now called the Online College Prep Program, which has been enhanced over the years, which most recently by Rutgers University. So that has been our general foray in since about 2007, but I'd say successfully since about 2010, and most recent success with College for America of Southern New Hampshire University, which is online competency-based education. We started that in 2014.
Oh, that's great. So what improvements do you think could be made on the technology you're using? What would you like to see in this enterprise technology?
I think maybe to continue to increase its flexibility, its mobility. Many of our programs can be used mobilely, but not as easily. So I think more access to our employees who are continuously on the move. And as many of our presenters talked about this week, making things small, digestible chunks and modularizing them, contextualizing to the work that people are doing every day is very important. I have a mentor who is our academic advisor, Dr. Harriet Tolpin, who has a lot of experience in academia, and she's been calling for many, many years to contextualize and modularize, make things bite-sizable pieces, and then people can embed them. So I think more flexibility. I think when we work with our platform and our online college prep program, there's a lot of things that we'd love to do that we cannot do. We're working on platforms that just seem a little stiffer than we need them to be. So I think that ability to more simply interact with them as a non-native tech person, and that my team can work more carefully with, rather than having right now when we make any significant changes, we have to work with a tech expert, we have to bring in a company, it's very expensive. So for us to be able to more easily interact, not being technical experts, would be great.
Yeah, I think that's a common need. It's the integration of technology that can slow things down, and you want to adapt new things, but you don't necessarily have the resources to make it happen.
Right, and the skills. And of course, we always have to be aware of security whenever our employees are involved in anything web-based. But I just think, honestly, just the ability to more readily interact with the technology as a common person, not a tech genius.
What about like virtual reality training or something? Would you ever consider that?
That would be so cool, because we have, as you know, in healthcare, many of the professions require internships and hands-on training, and we have shortages in many, many areas, including a simple area like certified nursing assistant.
Right.
If people could do their internships virtually, that would expand the market and the ability to get people trained more quickly. It would really break down a large barrier in our pipeline.
It would lower the risk factor, perhaps.
Exactly. Yeah, lower the risk factor. And, certainly you're always going to have to touch that human being. You're going to have to work with them. But if you could reduce the time that you need, we could increase our ability to train more people.
That's great. Well, thank you so much for speaking with me today, MJ.
Happy to meet you.
I hope you're able to enjoy the rest of the conference.
Thank you. I plan to. Take care.